You know, our vision is we envision a world free of violence and abuse. You know, pretty lofty. Like we envision that. Even if you make a small step towards that, then, you know, you've succeeded, right? Leave the world a better place than when you came into it.
When you think of trauma, what comes to mind? I doubt it's the Oxford Dictionary's definition. I bet it's closer to something like an image, a picture in your head, an experience, a story you've told, a story you've heard. I think it goes without saying that you can't scarcely be a human on this planet very long and not have some encounter with trauma. You might define it as the shattering of safety, the realization of something terrible and surprising. Not all traumas are created equal, however, and what we're talking about today is primarily emotional trauma. The worst forms of these tend to circle around personal safety, the safety of those you love, or being witness to, and even participating in some grave evil. One person well acquainted with all this is Natasha Thonis. She was the former executive director for Hinton Victim Support Services.
We are located within the Hinton RCMP detachment. We are our own entity, but we work very closely with the police officers. We essentially respond to requests from police officers to people who've been impacted by crime or trauma. So we do a lot of work with people who are the victim of a crime, whether that's a physical violence, theft. We respond to things like house fires, motor vehicle accidents where someone has been seriously injured or has passed away. Quite a few of the call-outs that we do with the police are death notifications, so we will actually go with the RCMP officers to someone's home to notify them if a family member has passed away.
I asked her how she handled that kind of heavy work.
Knowing where to go for help and asking for that help is the biggest thing, and I'll be the first to admit that I haven't always been great at that. It takes a lot to reach out to somebody and say, I'm overwhelmed or I'm on the verge of burnout.
Someone else whose work exposes them to a lot of trauma is Marge Luger. She runs the local women's shelter.
Like, why did you get involved with the shelter, and like, what are some things you've been learning personally by your time here?
Well, actually, I am a survivor, which probably a lot of people who work in the women's shelter movement are. I was actually a resident here prior to working here, like 4 years prior to working here. I was a resident here.
You must really care about your work.
I do. There's 2 days are never alike. So there's always something new. There's always new challenges. There's always new things to do. It's ever-changing.
Mm-hmm.
Like Natasha, I asked Marge about the weight of her work.
From the very beginning, I said I would never take anything home. You know, especially the children. They're not my children. If they're in danger, you know, children's services are there to provide that support. You know, to get them either permanently removed from the home or whatever has to happen, or some help for the family if the children are at risk. When there's children involved, it's a little more complex. You have to make sure the children are safe as well. But I don't take it home. So that's how I deal with it. I never take it home.
I think that's really healthy. And it's an important boundary, because if you're weighed down too much by, you know, the problems of your work, then you cease to be helpful at a certain point.
Yeah, and I never have, you know, and I always tell staff, even when they first start here, don't take it home. And you can't save the world.
It can be very heavy, again, because a lot of the work that we do, it's negative in nature. You know, even someone having their bike stolen, it doesn't seem like that big a deal, but for some people that can have a huge impact on them and can be really traumatic, and it does wear on you after a while. And so I think for myself, it's really important to kind of set the work and personal boundaries.
You might be sensing a theme here, that those who work with people who are in the thick of the mud of traumatic experience tend to be at risk to get dirty as well. But that's all of us. Trauma is not an option in the program of life for people. Trauma is part of the main coursework. One of the most brutal traumas a person can go through is the death of a loved one. Lindsay Rendelman and I grew up together in Hinton. When I was 11 years old, I got a fan stuck in her hair and she punched me in the face. Those were the days before we might have even known what suicide really was.
I had suicidal ideation as a 12, 13-year-old probably. But it was something for me that I keep a journal. And it was something for me that once I wrote it down, the feeling was gone. Like it wasn't something that kept bothering me. Yeah, so that I kind of carried on that way, thinking that everybody thinks that. And then I moved to another small town to finish high school. And when I was 23, I had my best friend. She talked about it. And I thought the same thing as I always thought, like, oh, she's just really upset. That's just what people say when they're upset, and it doesn't mean anything. But it did that time, and she died.
And that's the thing of it all. You can be a good person, you can love, but sometimes we don't know enough to help those we love the most. And that's what this episode's about. It isn't just about trauma, it's about safety. If you need help, you need to communicate it, and if you're able to help someone who needs it, you've got to do what you can to help them, or at least point them in the right direction. A lot of that comes down to creating a safe environment for them to communicate.
I wish I would have known how to handle that situation, because I was in that situation so many times with so many of my peers, and it could have turned out the same with any of them. But it took losing someone to actually learn that. And when I say learn, I went and I took a course. It's called ASSIST, Applied Suicide Intervention Training. It's like a first aid course, but for a mental health crisis.
ASSIST is one of the helpful courses offered in Alberta to people from all walks of life, not just medical professionals. As someone who has taken the course multiple times, I can confirm its utility, and I do wish more people were exposed to it. But this course is not always offered in Hinton unless there's a hosting body that's willing to bring trainers from the city, usually, to do it. And sometimes that could be an employer. Not everybody who needs this information that's packed into this 2-day course like this necessarily has access to it or has the funds to afford it. To go to the city and take it is like $250 out of pocket, and where are you going to stay? This is another example of how Hinton, like many rural communities, have challenges for accessing mental health related education. Related to trauma support, are there other challenges we have in Hinton?
You know, that confidentiality could potentially be broken pretty quickly because it is a small town and your neighbors, your coworker down the street might see you. We've been pretty fortunate here in regards to the confidentiality of the shelter and people realizing that it is a life and death measure to keep confidence.
For myself, one of the biggest gaps that I see is having a social worker full-time or so in, let's say, the hospital or the health center that can kind of triage some of those emergency crisis. I would say that for myself is probably one of the bigger gaps, just because then sometimes we've definitely had the hospital call us and they're not sure what to do with someone.
And if they had a social worker on staff who could basically look into those cases, they can be the resource pool.
We do have a social worker at the hospital, but it's just not
full-time.
Not full-time, and so I definitely feel like sometimes that resource could be broadened. And but again, I understand small town and the limits, financial limits, can be tricky.
As tricky as it can be, it's clear that so many people and organizations in Hinton are doing everything they can to make the individuals in our community more resilient in the face of trauma.
I think one of the things that I really noticed about Hinton, again, especially as being someone who's new, is that there is a lot of agencies in town that provide services, and everyone works really well together.
We should be honored to have it in our community because not every community has a women's shelter.
There's very much that team mentality here in terms of wanting to work together for for the collective good, which is inspiring, and it's fun to be a part of, and it's nice to have, different committees within the community, whether or not it's, the Rural Mental Health Project. For a long time we had a domestic violence committee.
We have seen small steps in family violence prevention. The more and more people are talking about it.
So that's what we're doing. We're talking about it.